A gynecologist is a doctor who takes care of women who are not pregnant. An obstetrician is a doctor who takes care of women who are pregnant. The obstetrician also delivers the baby. Every woman who is 21 or older should see a gynecologist once a year for a checkup. Younger girls may want to talk to a gynecologist about their menstrual cycle or about sexual health. You should go to the gynecologist every year for a checkup to make sure you are healthy. You can take a friend or family member with you when you go for your checkup. You can ask the doctor or nurse about anything you want to know. What happens when you go to a gynecologist for a checkup? First, a nurse checks your general health. The nurse will weigh you, check how tall you are, and check your blood pressure. You may be asked to also give a sample of your urine. Different clinics may ask for different things, but all these questions are about your general health. Next, you will go to an exam room. In some clinics, a doctor, nurse midwife, or nurse practitioner may come in and talk with you before your exam. She will then leave the room so you can get undressed for your exam. In other clinics, the nurse may ask you to undress and put on a gown before the doctor, nurse midwife, or nurse practitioner comes in to see you. After you are undressed, you will get on an exam table and you will be given a sheet to cover your lap and your legs. The healthcare provider will ask about your health history and see if you have any concerns or questions. Based on what you tell her, she may suggest you get some vaccines, like the flu shot or the HPV vaccine that helps prevent some women's cancers. This is a good time to share anything you want with the healthcare provider. For example, you can ask if something is normal or not normal. You can ask what will happen during the exam. It is important to share any health concerns or questions with the healthcare provider to make sure you get the best care. What happens after the questions? The healthcare provider will check your breasts. Breast cancer can be a dangerous disease. If it is found early, it can be cured. Some healthcare providers will feel your breasts for lumps. Some healthcare providers will ask if you check your breasts by yourself and may show you how to do that. Lumps in your breasts could be nothing important, or they could mean that you have breast cancer. Next, the healthcare provider will do a pelvic exam. This means you open your legs and put your feet in stirrups so the doctor can see and feel inside you. This is how the healthcare provider checks your female parts. It may feel uncomfortable. Tell your healthcare provider if something hurts during this exam. The healthcare provider will use a special tool called a speculum to open your vagina and see inside you. She may feel inside your vagina to make sure all your female parts are healthy. This may feel uncomfortable. Tell your healthcare provider if something hurts when she is examining you. There are some female cancers that can only be found during this exam. This is important because if cancer is found early, it can be treated and cured. The healthcare provider may insert a tool inside your vagina to collect a small number of cells from inside your body. The cells are sent to a laboratory to be looked at. This is called a pap smear and is recommended to have every 3 years. This may feel uncomfortable. Tell your healthcare provider if something hurts when she is examining you. After the healthcare provider finishes the exam and leaves the room, you can get dressed again. You may bleed a little after your exam. This is normal. If you bleed a lot, you should call your healthcare provider right away. What happens after the checkup? The healthcare provider may recommend that you get a mammogram. A mammogram is an X-ray of your breasts. A mammogram is another way the doctor checks for breast cancer. You will go to a different healthcare provider for your mammogram. The healthcare provider will tell you where to go for your mammogram. If there is anything wrong with your pap smear, someone from the doctor's office will call you in a few weeks after your exam to tell you. The doctor's office will tell you what your next steps are if something is wrong. They may want to see you in the office again, or they may want you to see a different doctor. You may need medicine. The doctor's office will ask which pharmacy is good for you and will either call the medicine into the pharmacy for you to go pick up, or they will give you a written prescription so you can go to the pharmacy and get the medicine filled. You should see a gynecologist once a year for a checkup. Annual checkups help you to stay healthy.